There we go. I'm going to go back to my screen. So this is our homepage. So just to recap what we went through yesterday, we covered adding on residents, we covered adding on users, we kind of went over homely remedies and some other bits and bobs in the resident and admin functionality. What we're going to do today is go back into our residents and orders, because that's where we go to put on the medication in the same screen, but a slightly different tab. So let's head in. You'll see a lot more data on this system than your live site. So we've got all of our residents here on the left hand side. This training home has quite a few trolleys, quite a few residents, probably quite similar to what you guys will see. So when you're up and running with the system, this is very similar to what you will see. You'll have your residents, you'll have lots of lovely colourful flags on the left hand side, which I'm going to go through in a minute. And then you'll have your trolleys. It as default will be trolley order. But if you needed to get to a resident quickly, you knew what room number they were, you can toggle at the top here. So you could click on room at the top and it will just toggle it into ascending or descending. You just click as appropriate. It does exactly the same with name as well. So if you're looking for somebody by name, if you click it, it will do it, descending alphabetical and then ascending alphabetical. Same with the trolley. So it's just an easier way once you've got loads of residents in there to find the one that you want to work on. Then you've got the bulk of the screen is the profile and the medication profile screen. So if I click on Lisa as an example, Lisa has got this wavy green flag next to her name, which means that she's got something in her medication profile that needs approving. And when I click on her name, it brings up a list of all of her medication on the top part of the screen here. And I can scroll down and see everything that's in her medication profile. So essentially, this is her current MAR chart. We can see that the alendronic acid, if I click on that, has that wavy green flag. And that's because this data has either been sent over from the pharmacy or it's been added on manually. So we're going to cover both today. Is that somebody else? Let's admit them. There we go. Back to the screen. Okay, so we're going to cover both today. So what I'm going to show you first of all is what it looks like when a pharmacy sends data over and what you would need to do with that. And then we're going to cover manually adding on a medication there'll be scenarios where potentially a resident gets an out of hours antibiotic or they're new to the home and you need to put the medication on straight away. So you will in times have to manually add medication, but for the most part, monthlies, generally interims will come from your pharmacy. So we've covered the green wavy flag. You can also see that we've got a red wavy flag. So you will only see this if it's been sent over from the pharmacy. What that means is it's medication that needs to be approved, but it's also missing something. So it needs particular attention. So if I click on Henry's alendronic acid that's got the wavy flag, but it's a red one, it tells me straight at the top, no defined schedule. So the care home needs to put a schedule in there for it to be approved and then go on to the drugs round. So we can see at the bottom here, there's no schedule. So your red flags need particular attention and need to be dealt with as a matter of urgency. We've also got, if I can find one, here we go, Helen. Helen's got this battery style green tag next to her name. That denotes that she hasn't got anything waiting to be approved. However, she has got something that's new on her MAR chart. So if I scroll down her medications, I can see the paracetamol is a new medication. It's been on there. So that new tab will stay on the system for 7 days. It will just let you know for 7 days that this is a new medication, and then it will drop off and it will look like all the other medications that we've got in here. We've also got the yellow one, which we can just see there for Helen on the warfarin. That yellow one means that drug has been discontinued. Again, It will stay on the system for a period of time. It will stay on the system for 3 days to warn you that it's been discontinued, and then it will drop out of her current list of medications, and it will drop into the background. So you can still access it for if you need to get access to it, if the doctor's asking or for whatever reason. Once it's dropped into the background, you would use this show discontinued orders tick box. So that's your discontinued. There's another coloured tab, which we'll cover later on when we suspend medication, but we'll cover that in a bit. So I'm just going to go back to Lisa, and we're going to run through her medication profile screen. I'm just going to check in on you and check you're all right. If you do have any questions throughout, guys, take yourself off mute and you can ask away. So if we go into Lisa's medication profile, I'm going to click on any of the medications just to bring up all of the fields. Once I've clicked on one of the medications, it opens up all of the fields at the bottom. So it's currently sat on the alendronic acid, and it's showing us the information for that drug. Just below your list of medications, we've got 3 tabs. It will, as default, sit on general because it's showing you in this screen the medications at the top and then the detail of the medication that you're sat on below. But I want to see everything, all of the information for that medication. So I'm going to go to my Everything tab. On this screen, sorry guys, I just need to cough, bear with me. Apologies for that, I've got a bit of a sore throat. It doesn't seem to be getting any better. Okay, so what we can see here, and this is if this would be an example of when the pharmacy has sent this medication over. So they've put this data on for you, and at this point you're just checking over to make sure it's correct. So it's telling us it's alendronic acid. It's telling us the strength and the form of the tablets. The pharmacist has also been kind enough to put the diagnosis in for us. And we have got all the other detail in there. So what you want to be checking, really importantly, I mentioned dates yesterday. So your cycle dates are in the system and they will roll on and roll on. What you need to make sure is that the pharmacy have put the correct dates in and reflective of your cycle dates. So the start date should be the start of the cycle, end date should be the end of the cycle for your monthly medication. The start time needs to be midnight, so all the zeros, because you want it to appear first thing in that round. It's not going to appear to be given at midnight. It's just that we want that drug to be on the MAR chart from midnight. And then same for the end date. So when it ends, we want it to be finishing at 23:59. We don't want to roll into the next cycle. That's really important when we come to cycle changeover, which we have a session for cycle changeover later down the line when we come back to booking your medication and extend your MAR charts for the cycle changeover. So really important that these are reflective of your cycle dates, and the times are midnight and 1 minute to midnight for your monthlies. Obviously, if it's a antibiotic and it's a course of say 2-3 weeks, 1 week, whatever it might be, those start and end dates need to reflect the course, and the times, again, importantly, so you don't miss any doses of that antibiotic. It could be that it comes in on the night time of the 21st, so you're going to give your first dose then, but then it's going to run an extra day. So you need to make sure the time is reflective of when that last dose or after that last dose will be given. Hopefully I'm making sense, guys. Please shout up if I'm not. Then we're going to come down into the middle part of the screen. So this, everything we do on this screen is how the medication will act within your drugs round. So if you come across a medication that's potentially a controlled drug and this controlled drug tick box hasn't been ticked, it won't appear as a control drug in the drug round. So this part of the system is really important. The setting up and making sure the meds are set up properly makes the whole of the process going forward a lot easier and smooth running. So this is the bit that needs dedicated time and attention. Once it's set up correctly, it will remember it going forward. So essentially, this startup period for you guys is the bigger part of the work, but going forward, it remembers it all for you. What we've got on the middle part here then, so you'll notice our track inventory is ticked. That's because we want a running balance for our medication. For any medication that can be measured, can be counted, we want that track inventory ticked because the system will then have a running balance for it. Things that you potentially wouldn't want the track inventory on would be things like creams. So although the instruction might be apply twice a day, we don't actually know how much is in that blob that we're squeezing out. Therefore, we would never know how many applications are left within that tube. So if you was to track that, it's going to get very messy. So you wouldn't want to track creams. You wouldn't want to track potentially inhalers. So some inhalers do have counters on them. But more often than not, it will get tested. So they'll do a test pump before the resident takes it, and then those test pumps aren't accounted for. Again, your tracking is going to go off par. So you potentially wouldn't want to track those. Anything that's countable, your tablets, liquids, you can measure in mils. All of that would be tracked. Okay. Then we come to these fields in the middle of the screen. So some of these will be mandatory. I'm just trying to remember which ones we said. I'm pretty sure we said it was the prescriber, the source and the route, all of these ones here. So it won't allow you to add on this medication until you have the relevant information in these fields. So your prescriber, like I said yesterday when we were adding on that homely remedy, it will start to remember your doctors, especially when the pharmacy starts sending data over with that information in there. So you should be able to just free type the first few letters and it will bring up a drop down box with your most common doctors in there. If it's a brand new doctor, you would just click on the little blue man and put in the detail of that doctor. Again, it's just your first name, your last name and the postcode that would be mandatory to save that doctor. Your source has to be mandatory. So you would have to make sure that you've chosen where that medication has come from. For you guys, so just remember this is my training site, so there's a lot of sources here. For you, you will see Houlihan Pharmacy right at the top because that's your most common one that you're going to be using. And then the route, you would have to just make sure that that's in as well. Generally, when the pharmacy sends it over, they'll put the prescriber in, they'll put the route in, but the source wouldn't automatically be put in there. So you would need to just quickly choose that one from the drop down. Okay, so then coming down to the bottom part of the profile, that's where we put the instructions in exactly as on that dispensing label. Again, once the pharmacy sends it over, they send all of that in pre-filled. And then at the bottom, they will have scheduled the drug for you as well. So this Alendronic has been set up as a once a week. So that's been set there for a Saturday. Now I'm going to come back to scheduling because I'm going to go and add some manual medications on and go through all the different scheduling options with you. But essentially, once you've gone over that information for the drug that the pharmacy sent over and you're happy that it's right, you can then approve it. To do that, you would come to just underneath your dates. You've got an approve button, you've got a reject button. If you're happy with it, you'd approve it, and then it would just say reviewed by and whoever is logged into the system. So you can see who's logged into the system, bottom right. So I'm currently logged in as Elizabeth Grant. And it's told the system that it's been reviewed by Elizabeth Grant. Now, if there was something really wrong with this data that the pharmacy had sent over, so they completely got the scheduling wrong at the bottom, you would have to reject that medication because it's not right, and then go back to the pharmacy and ask them to send over the correct data. Once you reject it, it essentially puts an end date of of the exact same start date. So it starts, but it ends immediately. So it never appears on the drug round. What you can do, if the pharmacy has sent over data and it's slightly wrong, so potentially they've got the timing wrong. So he's sent it at 7 o'clock, but actually you give it at 8 o'clock. That is a minor change. You can change that. You would just amend it and you would press your save button at the bottom right before you then approved it. But anything major, like the scheduling, so if you put it as daily, you would reject that data. Hopefully I'm making sense, guys. Please shout up if you've got any questions, or use the chat function. Okay, so that's what data looks like. You'll see as well now, because I've approved that tab has gone from the alendronic acid, and Lisa has gone to that new battery style flag as opposed to the wavy flag. Okay, so that's what it would look like when the pharmacy sends over data. What I'm going to do now is add on medication, and we'll go through some different scheduling scenarios. To do that, we're going to use our add button. So top right, just under the name of the resident, we've got an add button. If I click on that, it gives me a few options. Generally, everything you add onto the system will be medication. Anything that's prescribed will be medication. Your treatment would be for things like a peg flush that needs to happen, needs to be recorded, but actually it's not prescribed by the doctor. It's not on a prescription. So everything we add on today, we're going to do as medication. Okay, so once I click on the add button, it automatically, yeah.
Just ask a question.
Of course.
If you reject a prescription, is the pharmacy notified through the system, or do we need to call them?
You would need to call them. So essentially by rejecting it, what you're doing is ending it on the MAR. It doesn't send a notification anywhere. You would have to phone the pharmacy and say you've sent the wrong information. Now, I don't know how quick your pharmacy responds. So you could ring the pharmacy and say, look, you've sent the wrong data. I need you to send the right data. If they're really good and they send it straight away, brilliant, do it that way. If they're not great at getting back to you really quickly, you could just go in and add on the medication manually, as we're about to do now.
Right, okay.
But I mean, you guys know your pharmacy and how quick they are. Are you guys, I know we spoke at the kickoff meeting about scanners. Have you thought about that? Do you want me to touch on that in terms of how that would look?
Yeah.
Yeah? Okay, that's fine, just so I am aware. Sorry, I've only just seen that message. Right, guys, I'll go back to the screen. Okay, so the scanners then, if you're going to be using the scanners, the data that the pharmacy sends will generate a barcode, which will sit. If you can see my cursor, I'm just circling the barcode. It will sit in here. It will generate a barcode number. Now, you never have to do anything with this box because it will come from the pharmacy. But if there's numbers in there, it's because it's been generated by the pharmacy and it's got a barcode on the label, which you are able to scan. If they've sent over data and it doesn't have that in there, it's likely because it's not got a barcode on it, but as it should be automatic for the pharmacy that they send it over as barcoded. So that's what that barcode functionality is there. In terms of adding on medication, you wouldn't need to worry about the scanner in terms of adding to the MAR, because the pharmacy does that. The pharmacy sends the data for you. If you're adding on something manually, you wouldn't generate this barcode, so it wouldn't be able to be scanned within the meds round. So as much data you can get from the pharmacy, the better, because that's what generates those barcodes. Okay. So I'm going back. I'm going to add on a medication. Now I'm going to add on a very straightforward, simple one to begin with. Let's do a twice daily lansoprazole, let's say. So I'm going to start by, and And this is going to take me longer than it will do you guys. It's just because I'm going to cover every kind of scenario. So please don't think, oh my God, this is such a long process. It's just because I'm going to cover everything. So the medication, we need to put in the name of the medication. Now, I find that typing in capitals, because now I don't know how big the laptops are that you guys have got, but the system writing is quite small. So it's easier to read in capitals. So I just find by typing in capitals, it's just a lot easier to read and not get mixed up with. So lansoprazole, please excuse my spelling, but I think I've got it. 15 milligram. And it's going to be capsules. Now, I've touched on this. When you start typing, it will, as you use the system, remember all your common items, and they will generate at the bottom here. You could just then highlight the one that you want to use before having to write it all out. When you're first using the system, you've got your show all button here. I'm not going to press it in my training site because it kicks me out. There's a bit of a bugbear with the training. But in real life, you could press that show all and it bring up all your lansoprazole options that you could choose from. Right, strength is 15 milligram. There, guys. Form is capsule. And then I'm going to come down and work through each bit of information to make sure it's all correct. So I'm not going to touch on these just yet. We're doing a dead simple medication. The diagnosis, so my resident is taking this for indigestion. Probably not what it's used for, but that's what they're using it for. And the equivalent to, as I mentioned yesterday, is if you're used to giving a brand of medication, and I use, say, Paramol as a bit of an example, it's got more than one active drug in it. So you would put the medication name at the top, so it would be paracetamol and codeine, but your equivalent to, you could put Paramol just so you know what box you're pulling out. Then I'm going to come over to my dates. So I'm going to make my what I'm going to do, monthly dates. I'm going to start it from today. I'm going to leave it as that. They're my cycle dates. So I'm happy with that. But my timing, I'm just going to change that to 10 a.m. because that's not going to appear on my MAR chart until 10 a.m. But potentially I might need to give it at 8 o'clock in the morning. So I'm going to put that as midnight. So it appears on the MAR chart from the very beginning of the day. And then I'm going to come down. I need to track my inventory because this is a capsule. I can count them. I want a running balance for it. I'm going to come over and put my prescriber in. So let's find Miss Dr. Smith. The source, this has come from the care home pharmacy, care home chemist, there we go. And the route is oral. So remember, these ones are mandatory. It's not going to let me save the medication until that detail is in there. And then I'm going to come down to the instructions. So for this one, the doctor has prescribed it as take 1 tablet a day. The morning and evening. Okay, so that's the instructions, and it needs to be exactly as is on that dispensing label because this is replicating that label. Okay, and then I'm going to come down and apply a schedule to it. So like I said yesterday, as default, it will sit on routine because it's assuming all of these medications are routine medications, which is fine. This will have a routine schedule. So I'm going to leave that ticked. And then I'm going to come to my add. So the green plus. If I click on that, it adds in a schedule line for me. So at 8 o'clock, which is fine. I'm happy to give this at 8 o'clock. They would usually have it at 8 o'clock. the quantity of the medication. So I'm giving 1 tablet, that's correct. And it's going to happen daily. So I'm happy with that schedule line. But I need to schedule my evening one as well. So to do that, I'm going to press the add button again. And it adds in another schedule line. As default, it does go to that 8 o'clock. So you just need to make sure you amend that to the relevant time. So let's say it's 8 o'clock in the evening now that I'm going to give. You could use the arrows or you can free type with that one. Again, the quantity as default will be 1, but that's correct. So that I'm happy with that. And it's daily again. So that's my twice a day. If it was something that was 3 times a day, you would just add on another schedule line and so on. If it was 4 times, you would just do the same. So that's my schedule set. I'm happy with everything else. So once I'm happy with all of that, I press my save button. Now, when you're adding on a new medication, as a kick-off, we discussed that we're going to make it mandatory for adding on new medication, discontinuing the medication, when you're deselecting a controlled drug, and when you're adding in a split schedule, you have to leave a reason as to why you're doing that. So for you guys, it might be that all of your data usually comes from the pharmacy, but actually this came from an out of hours. So you could put out of hours prescription. And then you'd press OK. And then it saved it. Now you know it saved it because if you go back to your general and everything tab, if you click on general, it should, fingers crossed, there it is. It's now appeared in my list with that green wavy flag. Now it's got that green wavy flag because I've added on that medication, but before it can go into the meds round, it has to be approved by somebody else. So they have to, a bit like when you countersign in a MAR chart, that witness has to come along and check that that detail is correct and approve it. So you'll also notice that where the approve and reject button was before, it's greyed out because I'm logged in as me. I added on that medication. I cannot approve my own work. So I'd have to get one of my colleagues to come along, log onto the system and just double check it and approve it for me. Any questions or queries so far about that? That's a straightforward adding on of a medication. Give you a second if anybody does. No, perfect, right. So I'm going to add on another medication then. So if I go back to my add button, choose medication, and this time I'm going to add on a PRN. So let's add on a paracetamol. So you can see I've got paracetamol there. So if I tick the paracetamol, it pre-fills all of that for me. So it gets quicker as you use the system. The diagnosis is for pain. Okay, I'm going to come over, check my dates. They are correct, but I am just going to put this back to midnight. Again, I'm not using anything on this left-hand side just yet. I'm going to come down. I can track my paracetamol tablets. I'm going to come in and put my prescriber in. Wrong Smith. My source, care home chemist, and it's oral. Okay, so I'm not going to write out all the instructions you usually get for paracetamol, but we'll go with the gist of it. So take 1 to 2 tablets up 4 to 6 hours up to 4 times a day. Now, this is a PRM. So that up to in the instructions denotes that it's a PRN. So I'm going to come down and choose my PRN schedule option. It then takes away that add button because it makes it available throughout. I just need to pop in the minimum and maximum dose. So in the instruction, it's 1 to 2 tablets. So my minimum would be 1, maximum would be 2, and this is per administration. So if that was something like lorazepam, where you could have up to 8 in a day, it would always be whatever it is per administration. So remember, we've got our weight betweens and maximum dose up here, which we're going to apply in a second. But your minimum maximum dose here would be per administration. Because I've chosen this PRN schedule option, it has opened up some extra tick boxes that you only get with a PRN medication. So we've got our weight between admins. If I tick that, I'm just going to pop in there that 4 hours. So I don't want to give it any more than in between 4 hours. I'm going to tick my maximum 24-hour dosage. So from the instructions, I can work out that it's a maximum of 8 tablets. So if I put 8 in there, what that's going to do is if I try to give it from that first initial administration, if I try to give it within that 4-hour period, it's going to bring up a warning sign to say, are you sure? It's only been X amount of time. There is a risk of overdose should you give it. And the same with the maximum 24-hour dosage. It would warn you after you've given that 8th tablet. If you try to give another one, it would say they've hit their maximum dosage. Are you sure you want to be doing this? Now, like I said yesterday, it won't stop you from doing it. It will warn you and give you the option to go back and not do it. But it will also let you continue, because there might be times when the doctors come in and said, actually, yeah, they need an extra dose, or whatever the situation might be. So it would never stop you from doing it. Once we've got that detail in, I'm just going to come over. Got somebody else come in. Okay. I've lost my train of thought now. Okay, so under the maximum 24-hour dose, we've got the follow-up time. So any PRN that you add on will automatically, as default, generate a follow-up for you to go back in X amount of time to find out if that's been effective. The default time for you guys that's set on the system is 2 hours. Should you need to amend that at this point, so it might be a lorazepam that you wanted to go check back and see a bit sooner, you could change that time here for that medication. But we're going to leave it as default. 2 hours is enough time to go check and see if this paracetamol has worked. On the left-hand side, we're not going to use this for the paracetamol, but there might be PRN medications that you would expect wouldn't need a follow-up, because you would expect that result to happen straight away. So you could use your tick box to say follow-up not needed, and it won't generate that task for you to go back later on. What it will do is say, it will ask you to give an effect result straight away. So if you've given that angina spray, has it worked straight away? So we want our follow-up on for our PRN paracetamol. Okay. Once all of that detail is filled in and you're happy with it, again, we just press save. Again, you'd put your reason in why you're adding on a medication. And then if I go back to my general, I should say, and now Lisa did have paracetamol already in there, so I'm not going to approve this one, but I can now see that paracetamol that I've just added in. What we have here, so Lisa did have paracetamol already on the system. At the moment, it's allowing the 2 to be there because this one has been approved and it's already in the meds round. This one hasn't been approved yet, so we cannot give that. So there wouldn't be an error of giving that twice because that one's not on the med round yet. I will approve that later so I can show you what would happen if you had duplicates. So we'll come back to that later on. Okay. Now I'm going to add on slightly more complex medication. So let's go with a fentanyl patch. So we've got a bit of controlled drug, we've got a bit of everything going on with this one. Fentanyl, 25 mcg. Awfully spelling. Oh gosh. Okay, put the strength in. And the form. Diagnosis again for this one would be pain. Check our dates are correct. So I'll put that back to midnight. And then that's where I'm going to start using these tick boxes on the left hand side. So obviously fentanyl is a controlled drug. The pharmacy, when they send that data over to you guys, will automatically be ticked as controlled drug. Anything that they deem a controlled drug, they will send over as search. What we'd also might need for a fentanyl patch is a body site, so we know where we're applying the patch in the meds round. So if I tick my note body site at the top, it then gives me this little blue compass where I can define what the site rotation might be. So if I click on the compass, I have a list of all of our sites that are default. This is configurable, so if you wanted me to add anything in that you feel is missing, I can do, or if there's anything in there that you don't use, I can take out. But for the purposes of today's example, I'm just going to choose random ones. So you would just choose the relevant sites that you're going to potentially apply this patch. So you have to do it one by one. So click your first one, press the add button, and then it starts putting it into a rotation list for you. So you just add in all the relevant sites to begin with. And then what you would do is you can then define what your rotation list would be. So at the moment, on your first initial application of this patch, you will say where you've applied it. So which one of these you've applied it to. From then on, so if I chose right arm, the next application is going to tell me to put it on the left chest wall because that's the next one in the list. So you can define what this list looks like by using your move up and move down to move them all around and make sure it's the rotation that you want. Once you're happy with that, or if you've accidentally put one in, just press remove, it'll take it out. Press OK once you're happy. If you then hover over the little compass, you can see that you've now got rotations in place. So as point of reference, if you just hover over, you can see what those sites are as they're initialed. I'm not going to use any of the others for this drug. So we've got note body site ticked, we've got control drug ticked, happy with my dates. I'm going to come down to this middle part now. So it's a patch, I can count my patches. So I'm going to track my inventory, make sure I put in my doctor, where it's come from, and the route. So this one would be transdermal. Okay. And then come down to the instructions. So the instructions for this patch are apply one patch oh, 3 days to alternate sites. Okay, so every 3 days is the schedule for this one. So to do that, I'm leaving it on routine and I'm going to add in a schedule line. Now it's only once daily, so I only need one line. I would usually give this say tea time, so let's change that to 1700. It's one patch that I'll be applying, but I need to change this daily because I'm not going to give it every day. So if I click on the drop down, it gives me a list of scheduling options. For this one, I'm going to use every N days. With that option, what it will do is give me the opportunity to dictate when it's going to start, when it will appear in the medication round. So every 3 days. And what you would also need to know is when the last time it was applied so that you could figure out what the starting date for this would be. So we're just going to say that this is going to appear, it should be due today. So we'll leave that as the 11th. And then every 3 days, it's from that date, it's going to pop up and it will continue. Again, once we're happy with all of that information, we would save it, put in our reason why we're adding on the medication, and then go back to the general tab just to check that it's sitting in that list now, and it is. Okay, so that's your controlled drug. Like I say, if I just go back into that, that controlled drug is ticked, so it will act as such within the drug round. Really important, like I say, it'll be automatic when the pharmacy sends it over, but anything you're manually adding, you need to remember to tick that. If you was to try and untick it, it's going to ask why you are. So you've got an audit process for everything in the system. So it's asking you why you're taking that controlled drug off, because whoever's put it on has said that it is a controlled drug. Okay. So I'm going to add on, can I just check, do you guys, I know we've spoke about this, in terms of vitals being applied at medication level, do you have any specific examples? So do you have to take blood glucose? Do you do your insulins? Or do you give take a pulse rate for digoxin?
We would need it for digoxin, so we'd need pulse, INRs for warfarin,
okay,
and blood sugars for insulin.
Okay, let's use that as an example now then. Go back to our screen. So I'm going to add on a digoxin, and I'm going to show you how you apply a vital to a medication. So we go back to our add button, we're going to add on a medication, just fill in the details. So digoxin. Okay. You check your dates as normal, okay, and then we're going to come over to our tick boxes here. So we've got record at the bottom of the list of tick boxes. If we tick that, it gives us a list of vitals. Now you can apply more than one vital recording to a medication. So you can add up to, what have we got here, six vitals. Generally, you would only really need one. There might be occasions where you need two or three, but I'll show you how to add on the one. So it highlights automatically the top drop down. If you click the arrow, we're going to choose the test that we want to record for this medication. So for digoxin, it would be pulse. If there was more than one, you would just go through and do the same with all the others. Click anywhere in the white space to take you out of that box. Okay. And now we can see that we're going to record a pulse for this medication. What that's going to do, and it'll be clearer tomorrow when we go through, no, not tomorrow, the day after, when we go through med round, exactly how that looks like, but it's going to ask you for the pulse when we're administering this medication. Fill in all the other details. So we're going to track it. We need our doctor, our source, route. Okay, instructions. It's usually something like take one tablet course is within range before administration. Now we've got that pulse vital attached now. What we might also want to do is we've got a little note functionality. So it's really tiny, so I'm hoping you can see it on the screen, but I'm hovering over it and it says add note. It looks like a little Game Boy icon. If I click on that, it opens up a free text box for me, so I can write whatever note I want to write in there, in addition to what the instructions might be. So the instructions is exactly what's on that label, how it's been prescribed by the doctor, but you might have additional notes of how that medication needs to be taken. So you might want to put in there, if below 60, omit the tablet. and you're going to be able to see that during the meds round when you're giving the medication. So again, that'll become clear when we go through the med round session. Again, to save that, just click anywhere in the white space and it will save that data. Go through as you would normally and add in your schedule. So this one we would usually give in the morning. So I'm happy for our 8 o'clock. We're going to give 1 tablet and we're going to give it daily. And you would just save it as normal. Put your reason in and it should then go into our list of medications. She's going to have a lot of duplicates, Lisa. Okay, I'm just going to show you because we mentioned insulin. So if I go to Lisa's Humulin and show you how we've set this up. So with the insulin, we would use the same record functionality, only we'd use BG for blood glucose. And we've also got the sliding scale functionality. So once you've ticked that, and I use this as an example because it's already set up. If you go into the calculator, you can set parameters of what should be given dependent on what the result of the test is. So with this vital, we're saying if it's less than 5, we're going to give 8 units. And it'll, as soon as you put your result of that test in the administration screen, it will say, right, you need to give 8 units then. If it's in between 5 and 10, it's going to tell you you need to give 12 units. If it's any more than 10, it's going to say don't give anything. But you've got this message functionality here. So what it's going to tell you is you need to phone an ambulance. If it's over 10, you need to be phoning an ambulance and not giving any insulin. These two at the top have been left blank, but you could use those as well. If you needed to add in more parameters, so it might be that you needed it between 5 and 7 and then 7 and 10, you would just add a row in and amend it accordingly. That's your sliding scale. That's what you would use on Humulin. You might find it useful for other medications as well, but it's most popular with the insulin. Okay, I'm going to go back to my general. I'm going to add on something a bit more complex now. So you might get is someone wanting to ask a question? Any questions? No?
Yeah, Lee, see when you were showing us there about the sliding scale for the insulin,
Yeah,
that would work as a protocol, really telling us what to do and when to do it. Could we use a protocol like that for as required rectal diazepam for people with seizures? Could that
so
work there?
what vital, so that only works when you're applying a vital test to it. So what vital would you be applying to?
No, I was just wondering if we could use it because that's really a diabetes protocol. I'm just wondering if we could use that as an epilepsy one as well, but never mind.
No, it's only there if you're able to apply a vital to it. Okay. Let's add on. So you might find that you get an antibiotic and it's this is going to get quite complex, but do you have antibiotics that potentially, like a prednisolone, is a take 3 for the first week, take 2 for the next week, take 1 for the next week? Do you ever have those scenarios?
Sometimes, yeah, if you're reducing it down over time, yeah.
If it's been titrated.
Yeah, so I'll show you how you can schedule those because you can do that on the system. So let's add in, like I said, prednisolone. Okay. Put all of our details in. Okay. Oral. So the instruction for this prednisolone is take, I'm just doing it all in capitals, I know this is not how it usually is, take 3 tablets for week 1, then reduce to take 3 tablets a day.
Daily. 1 week.
One, then reduce to two
tablets daily.
2, and then 1 tablet for week 3. Okay. So with this one, because it's a 3-week course, I would need to reflect the dates to be 3 weeks long. So it's starting on the 11th. Let's work this out. So it'll be 1 to 31st. I'm going to come down and I'm going to add in my schedule line. So it's only a once. I'm giving 3 tablets. I'm giving 2 tablets. I'm giving 1 tablet daily for the period of time. So I'm going to leave it as 1 schedule line because I'm only giving it once a day. What I am going to use is my add part button. So can you all see that? It's add part next to your instructions. If you click that, it adds in another box for me to fill out. So I've got part 1 where I've just put the instructions in and a schedule line. I've got part 2 where I need to fill that detail in. But actually, because it's a 3-week course, I'm going to add another part in. So these are all reflective of the 3 weeks. So week 1, I'm going to schedule it as the first part of the instruction. So take 3 tablets a day for this week. Okay. So let's say we're giving them at 8 o'clock in the morning. That's fine. But I'm going to change my quantity to 3. And it's daily. So that's fine. I'm just going to explain what this is. So this is your alerts. This will pop up throughout the training site because I'm not giving any medications at the minute. So it's telling me that I've got medications to give to all of these relevants. And that's what you will see if you are over 90 minutes due to give the medication meds around though. So back to scheduling. So we're going to give 3 tablets daily for this week. Now I need to tell the system what the time frame is for this week, and to do that I'm going to use the advanced button, and I can set my start date as today, and I'm going to set the end date for this schedule as a week later, so the 17th, and then press OK. So it's applied for this week. I'm giving 3 tablets at 8 o'clock in the morning every day. I then go into part 2. Now, bit of a tip, you have to write the instruction in again, so it's probably better to copy and paste rather than writing it all out. Paste it into that box. So we've got our instruction in part 2. We're going to add in a schedule line. Again, we're going to give it at 8 o'clock, but I need to amend that quantity to be 2 daily for this week. We need to dictate what those dates are. So set the start date and it will be the 18th. And the end date for this schedule will be the 17th. Okay. And then do exactly the same for part 3, but we're just going to amend that quantity. So add in our routine. It's going to be given at 8 o'clock. It's going to be 1 daily at this point, and then we just need to put those dates in. So start date will be, now I've lost track, so we went the 25th. End date will be the 31st, which is matching up to what we've put on the MAR chart. Press OK. So we've set 3 different schedules across 3 different weeks there, and it's just going to titrate. So essentially what it's going to do, from the 11th, it's going to tell us to give 3 tablets, and that will end on the 17th. From the 18th, it's going to tell us to give 2 tablets, that will end on the 17th. And then the last week, from the 25th, have I done those dates right?
No.
No, I've not. Let me amend that.
The 18th, it would finish on the 25th.
We'll finish on the 24th.
I think we started a new one on the 25th.
And then it will end, it will come off the MAR chart on the 31st. Now we just obviously, it's only 1 daily, so it's not going to ask us to give any more, but if that was a bit more complicated and it was 2 daily, we just need to make sure the time reflected was after that 2nd dose, but because it's only going to tell us to give it on once on that day, it doesn't really matter for this one. Does that make sense to everybody?
Yeah.
Hopefully.
Yes.
Fab. Okay. Oh. You would use that in the same way. So your parts you can add schedules to. You could use that in the same way if you had an antibiotic and the doctor had come in. So it was amoxicillin and he wanted you to give one there and then, but it was the night time. So it was one dose. You could set part 1 for that one dose. So 8 o'clock, set your dates to be the 11th, finish on the 11th, and then set part 2 as the rest of the course. Okay. Okay. I'm going to just add on a couple more just to go through other options that you've got. Let's add on in terms of creams and things like that, do your care staff apply those? And you wouldn't normally record them on the MAR? They'd be recorded on cream charts.
No, they're recorded in the MAR.
They're recorded on the MAR. Okay, so you would add on a cream the same way you would any other medication. I'm just going to show you an example of something that potentially might be given by somebody else. So let's say they self-administer a cream. So let's put a Citroen. Cream hasn't got a strength, so we'll leave that blank. Put the form in as cream. We want it to start at midday. Okay, so what we could use is this given by functionality. So if I tick the given by, you've got options. So if they self-administer all of their medications, you would set the medications up as given by self. And what that will do is the information will be in the med round, but it'd be greyed out. Because you know that they're on that medication, but you don't need to do anything about it because they are going to administer it themselves. Other options you've got here is there might be medications potentially that the family member administers, in which case you could use family, and then you could specify which member of the family that might be by using the box to the side. Home health, so some homes that have their carers apply the creams but won't be signing it off on the system. You could use home health and put care in there. So it would treat it the same way as you self-administer. It would put it in the round so you can see that they've got these creams on their MAR chart, but actually it's the carers doing it, so they're not signing it off on the system. They're doing it on their cream charts. It might be that they're in hospice and so they're having medication administered there. Or it could be that the district nurse is coming in to administer a medication, in which case you could use the other functionality and just put district nurse in there so you know who's giving that medication. Essentially, if you're not administering it and signing it off on the system, you'll be using this given by functionality to say who is, but that you don't need to sign it off in the med round. Does that make sense to everybody?
Yeah.
Perfect. Okay. Obviously with Citroen cream, we wouldn't need to track it. So we would leave that unticked because we don't know how much is in a blob of a cream. It would be, what have we got? Topical. I needed. And that would be a PRN. Again, with your cream, you don't necessarily need to put a minimum and maximum dose in because it's just as and when they need it. There's no danger with this cream that it's going to overdose, so you wouldn't need to specify that. You wouldn't need to put a weight between through or anything like that. Potentially you might want to put that a follow-up's not needed for this if it's just a daily cream that they're having. If it's something that's treating a dry patch or something, you might want to put that follow-up on to see if it has worked. And we put a reason in, and that adds it to our list of medications. Is there any kind of scheduling scenarios that I haven't gone through that you do come across quite often in your home?
Sorry, Parkinson's?
Okay, so time-specific medication? Yeah.
Yeah.
Okay, so when you're adding on, let's go back. When you're adding on a medication, we obviously specify when we want it to appear on the mark. We obviously specify the schedule. So if I add in a schedule line, with the Parkinson's medication, it's specific times, isn't it? I won't add them all on, but let's say we need to give a dose at 8 o'clock. What we can do is use this change alert to. So at the minute, our alerts are coming every 90 minutes. That big pop-up that you saw earlier telling us what medication needs to be given, that comes every 90 minutes after it's been scheduled, so after the time it's been put here. Now we can change that alert time for specific medications to be whatever we want it to be. So if we've got a Parkinson's medication, or you could use it for things like an alendronic acid that potentially needs to be given before breakfast, we can set a minus figure in there. So it's going to warn us before we're due to give it, not after we should have given it. So if I put in there minus 10, that's going to alert me 10 minutes before it's due that I need to give this medication. Therefore, I've got time to prepare and go and give it on time. Does that make sense?
Yeah.
Perfect. So you would use that for your time sensitive ones, for anything that needs to happen before something else needs to happen. So before breakfast or something, for examples like that. Okay. Any other scenarios? The system can schedule absolutely so much complex schedules, which you probably don't come across. But there'll be the times that you come across the one and you would need to. You would schedule any kind of weird and wonderful ones using your little drop down where it says daily. Daily would be your regular one. Days of the week is like your alendronic. If you have to give it every Saturday, you would just tick Saturday and it's going to appear on that Saturday for you. Every end days would be if it's every 72 hours or every 5 days or whatever that might be, where you can specify when you're going to want that to appear in the MAR chart. There might be, and these are very rare, I don't think I've ever come across these, but there might be medications that you need to give on specific days of the month. So it might be that this drug has to be given on the 1st, 7th, and say the 19th. For whatever reason, that might need to happen. But you can specify that I want this drug to appear on the 1st and the 7th and the 19th of the month. Okay. One time, so when I mentioned about the antibiotic where the doctor might have come in at the night time and he wants you to give a stat dose, you could use this functionality. So just one time on this date, I want to give 1 tablet. So you would do that as your stat dose. It will appear for that one time and then it will drop off into discontinued. You've then got advanced options. So this goes into really kind of complex scheduling, which you're probably never going to use, but it's there. It's good to know it's there. So like I say, you can schedule on the 1st, 2nd, 4th, 1st, 2nd, 3rd and 4th, whatever day. So you can specify a day of the month. It's getting really complicated now. You can specify something that's an annual medication. You can specify if it should be given on even numbered days, odd numbered days. There might be scenarios where you need to give, hold, and then give. So say give a medication for 7 days, hold it for 7 days, and then start giving it again. Generally, I think I've only ever seen that used for contraception, where it needs to be given for 21 days, held for 7 days. But there's so much complex scheduling. It can do so much for you. But like I say, very rare would you ever come across any of this. Okay, so I've gone through kind of all the scheduling scenarios. If a shout up now if I have missed anything that you want me to go through. If not, I'm going to move on to the next thing I need to show you. Give you a minute to shout up if you need to. No? Okay. Okay. So yesterday when we were adding on our resident, I showed you the out of facility functionality. So if they're leaving the home for more than 24 hours, you'd use the out of facility functionality. If they are leaving for a couple of hours in the day because they've got a doctor's appointment or a hospital appointment, and they're going to take their medication with them and do it there and then, you can record that that medication is on hold. So if I come to, what should we do? Let's come to Lisa's Senna. Okay. If I want to hold this medication, it might be that she's got a course of antibiotics for 7 days and it interacts with this medication. So I need to stop it for that 7-day course. I'm going to come to my suspend. You need to make sure the medication is highlighted and then come to the suspend and hold button at the bottom of the screen. It then brings up this box. It's going to ask you to put a date in for when you want the hold to begin and a time. And it's going to ask you for the date and time that you want it to resume on the MAR chart. Now, I know for a course of antibiotics, when I want this to drop back in, say a week later, so the 17th, it might be that they've gone out for the afternoon. And so you could just specify that it's the 11th and actually I want it to drop back in on 5 o'clock. Okay, you can manipulate this as and when you need it. You wouldn't, if you didn't want to use the out of facility button, because you'd have to remember to go and put them back into facility after they've come back from a week, you can use this just to schedule it for the week. There's different ways of doing it. You can also do it for just the medication that you've highlighted, which is as default it sits on, but you could do it for all of the residents' medications. So if they were going into hospital for a week and you wanted to do it this way, as opposed to the out of facility function, you could do all of the meds all in one go, say they're going to come back on the 17th roughly, and put a note in as to why. Whatever the reason might be. And then what will happen is from this date and time, it will get grayed out on the meds round. So you know that they're still on those medications, but you're not giving them, you're not signing them off. And it's going to come back in colour for you to give on the 17th at 5 o'clock. Now, we have to put a date in here because the system wants to know when it's going to resume. With a hospital visit, it might be that you don't know exactly when they're going to come back. What you would do is put a date in, but if they came back sooner, you would just come back into your suspend and hold and amend the date to when they've come back in. Or in the other instance, if they're extending their absence from the home, you would just go back into that date and extend it out. It's editable, it's not locked in. Okay, and you would just save it. And then you can see that once you've saved it, all those ones, it doesn't do it for the approved ones because they're not approved. They're not in the round anyway. But all of the ones that are live at the minute have gone to this orange tab because they have been suspended. Okay. And then to just unsuspend, click on suspend and then change the date to whenever they're coming back in and you want it appearing back on the MAR chart. But if they are coming in at that date, you don't need to do anything else. It would just continue from that date and that time. Okay.
Yep.
Any questions about that from anybody else? No? Okay. So we need to show you how to discontinue a medication as well. So if I go to David, and the doctor's come in and said that actually we're going to stop his lactulose. So you would find David, you would find his lactulose, highlight it, and then you are just going to change the end date to when it's discontinued. Okay, so doctor's come in, he said discontinue it from now, it's not to have any more. So we're going to choose today's date. The time will be, put it closest to the hour. So let's say 11 o'clock. And then when you try and save that, oh, prescriber, I need to put a prescriber in. That's what it will say. If you miss any of the mandatory fields, it will warn you and say you need to go back and put in this field that I need. Okay, let's try that again. Oh, might help if we're on the right date. There we go. So I've tried to discontinue it. Because I am discontinuing the medication, it wants me to have a witness there to sign off to say that it's okay. So I'm going to put my witness signature in. Remember what I'm signed in as. Okay. And then it's going to ask you why you're discontinuing it. So Dr. Smith has DC'd as not effective. And then you'll notice that we get that little yellow tab that says DC'd. It appears as such in the med list as well. And again, like I say, that will be there for 3 days. It will drop off into the background. If you did need to get back to it, you would come to the show discontinue orders tick box at the top. No. And it will show you all of your discontinued medications. Oh, David hasn't got any at the moment because they're sat inactive. But once that drops off, at the bottom it will say discontinue orders and they'll all be sat underneath there. Any questions about discontinuing a medication?
No.
No. Has anybody got any questions about what we've covered today? Because we've gone through everything that I need to show you. We've covered what it looks like when the pharmacy sends over data. So you'll get these kind of green and red flags that tell you need to approve that medication. We've gone over manually adding the medication. So can I just check, Sandra? So the pharmacy, I know they've got their training coming up. You might want to check with them to see if they're adding everything on. So potentially you might not have ordered everything that would be on the MAR chart, because if you've got PRNs that you've got enough stock of, you wouldn't have ordered it. But you just need to see if the pharmacy are going to send that data anyway, even though they're not sending the stock.
Yeah, I'll check that with you.
Yeah, because if they are, brilliant, it saves you a job. If not, you would have to manually add on that medication so that you could add on your PRN carry forward stock. It's just worth checking with the pharmacy.
I'll do it.
Well, when he has his training, I'm pretty sure Lawrence will ask him to put it all on, but just double check with him. So we've covered manual add-ons. We've gone through different scenarios of the scheduling, covered in quite depth with that. You've gone through how to suspend a medication, how to discontinue a medication, and how to approve medication that's either been manually added or been sent over by the pharmacy. Any questions from anybody?
No.
No. I think what might happen, you might take a bit of time to digest that. So if you do have any questions tomorrow when we jump on to our stock management call, I can answer any questions that you might have. Essentially, what we've done today is added those medications to the MAR chart. Tomorrow's session is about dealing with the stock side of it. So applying stock to those medication profiles, how we manage that and audit it. So I'll go through that kind of the system, part of the system tomorrow. But if nobody's got any questions, I can leave you to your day.
So if you can record the training.
Thank you, Lee.
You are welcome.
Thank you.
Sandra, did you want me